Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, the Answer Company. The Division Championship Minnesota Twins are looking to go all the way to the World Series in 2024. Bolstered by inspirational shortstop Carlos Correa, a healthy Brian Buxton, and rookie phenom Royce Lewis, plus a pitching staff led by Pablo Lopez and an outstanding bullpen featuring Johan Duran, the Twins are the best bargain in the major leagues, and Target Field is the best venue in baseball. Sheridan Dulas & Kins, PA, a family and criminal defense law firm, has been serving clients in Dakota County and throughout Minnesota for over 40 years. Ranked a Tier 1 Best Law Firm by U.S. News and World Report every year since 2009, Sheridan Dulas & Kins are here to help you in your most difficult life circumstances. Established in 2007, 45th Parallel Spirits was among the first 50 micro-distilleries in the United States. Based in New Richmond, Wisconsin, all aspects of production occur at our facility. If you're interested in visiting and learning more about the 45th Parallel Distillery, please check our website and plan a visit to tour our facility and taste our spirits. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org.
Hello and welcome to Access to Democracy. Thank you for joining us today. I'm Bill Raker, your host for this edition of the program. Today we have in our studios guests from the Office of Public Affairs of the Social Security Administration here in Minnesota. So it's a pleasure to welcome Rhonda Whitenack and Brian Rudolph from the Social Security Administration. Glad to have you as guests on Access to Democracy. I'm sure we're going to learn a lot about what the Social Security Administration does to help consumers, because that's the topic of our discussion today, how Social Security Administration serves the American people. So let's start with a little bit of background on what your roles are at the administration. Rhonda, let's start with you.
Okay, well, first of all, thank you for having us as guests. Brian and I are excited to be here in order to talk about Social Security, the benefits that Social Security offers, the American citizens, as well as information on how to communicate, how to get information from Social Security to help you and your family when you're looking at benefits. And so I'm originally from Wisconsin, born and raised in Wisconsin, went to college in Wisconsin, started my career in Wisconsin, and then my husband was transferred over here to the Twin Cities area and spent the second half of my career here in the metro area.
Well, we're delighted that you moved from Wisconsin over to Minnesota, so welcome, Rhonda.
Thank you.
Brian, fill us in on what your role is.
Yes, absolutely. So, Public Affairs Specialist and Outreach Coordinator. I've been with the agency for 21 years and in my current role for the past 6 years. I do have to admit this is probably the best position within the agency because we have the ability to go out and prepare people for what to expect when they call upon us to start collecting benefits. We have great relationships with our media sources, so we offer news articles and information packets on a monthly basis to a lot of our newspaper agencies and partnerships. We give TV appearances, radio shows. We have great relationships with our congressional offices, and we present on a weekly, daily basis to Fortune 500 companies, small businesses, a lot of great partnerships within the communities, community advocates, your county workers, and then we present to federal, state, and local partnerships as well. So we are out there as often as we can simply to let people know what we have to offer and how to conduct business very easily with our agency.
Well, you're perfect guests for Access to Democracy because that's part of what our mission is with this program, is to help inform our viewers, the public, about some of the things that our government, our officials and our agencies with the federal government can provide. So just another question. How large is the staff for the agency or the administration here in Minnesota?
Well, here in Minnesota, we have 17 offices.
We have actually 29 field offices and a Minneapolis card center. And all in all, I'd be guessing, but I would say about 250 employees, I think, within our area that we serve.
Right.
And we serve all of Minnesota and northern Wisconsin. So
Right.
between our full area, we have 29 offices and the one Minneapolis card center.
Okay, I
Right.
was going to inquire as to what geography you serve, and you clarified that for us, so we appreciate that.
Right.
So tell us about some of the things that it's important for consumers to know about what the Social Security Administration can do for them. Rhonda, you want to start and tell us a little bit
Sure.
about
Well,
that?
we really want individuals to know that Social Security is not just a retirement program. We have many, many benefits that we administer. The retirement is the core piece, but in addition to that, we offer benefits to spouses, to divorced spouses, to widow and widowers. If a person finds that they're disabled, they're able to apply for disability benefits and receive a disability benefit. And the important thing to know also is it's just not the worker themselves that could get a benefit. It could be a family benefit also, a benefit to a spouse or young children. If a worker retires, if a worker passes away, if a worker becomes disabled, that's protection for the family. So in addition to the retirement benefit, we also look at it as a type of life insurance policy, a type of disability insurance policy. So we offer many, many benefits at the Social Security Administration. That's why we are so busy.
Well, this is a busy time of year.
That's correct.
Brian, are there new services, new programs that are becoming available to the consumer?
So as far as services, how we conduct business, there are new things obviously being added, especially online and how people can conduct business. We have an 89-year history with Social Security, so we were established in 1935, and ever since then we're adding new benefits and new services all the time. And that online service really is a great option for the public, and we try to incorporate that into all of our presentations and all of our communications. And we understand that not everybody has access to internet, but for those that do, it is a very safe, secure, and convenient option for people to conduct their business right with our agency, when and how they need it, so they're not having to call in and not having to wait over the phone to speak to one of our representatives. But obviously, our representatives are available for anybody who does or would like to speak with one of our representatives. So online services, most if not all business that you'd have to conduct with our agency can be done right online. Whether you want to take an application, file an appeal, or conduct all your business ongoing once you're on benefits. So you can take those applications, update your address, phone number, direct deposit. You can get your replacement Social Security cards, Medicare cards, 1099s for tax season. Again, pretty much everything that you need to do can be done right online, but we do have other options for phone appointments and in-office appointments for those that want to deal directly with our agents.
Well, let's talk a little bit about working online with Social Security Administration. I don't want to go too far into the area of fraud and scams, but I do want to have you talk about something that happened to me, and I'm sure I'm not the only one, within the last week or so. I get this email, official looking email, that says it's from the Social Security Administration, and that the statement of benefits has been recently redesigned, and it's brand new and digital, and I can now access it online, and I should sign in to this website and access my Social Security benefits statement. And it gave me all the reasons why I should do that. Now, I didn't do that because, for a couple of reasons, I saw that the email was not from ssa.gov. It was from somebody at Gmail.
Yep.
Right.
Okay, a phishing attempt, right?
Right.
There were other clues down in the body of the email. Instead of addressing me as my name, William Raker, it said, "Dear user," which was a little bit offensive. So let's just spend a moment talking about those kinds of phishing attempts that our viewers should be aware of and not get caught up in a scam?
Well, I appreciate that you took note of those few clues. First off, we want to verify where is this information coming from. So making sure that it's coming directly from our agency at Social Security Administration, and especially ssa.gov. .gov or anything other than that, like a .com or a Gmail, you know it's not official. So we want to make sure it's coming directly from Social Security. And in order to do that, it is a great opportunity for our agency to offer these online services and create that dedicated My Social Security account. When you do that, we're authenticating who you are as a user.
Exactly.
And you can get all of your information, all of your notices, all these letters directly through that account. So you have to log in through ssa.gov/myaccount in order to get that information. Social Security will mail out certain letters, certain notices, if you have active business with our agency. We will not be sending stuff out personally regarding your situation if you don't have active business going on, okay? So it's very important to know that. And if you ever do inquire, hey, is this legitimate or not, certainly call our national number at 1-800-772-1213. And you can either speak to one of their representatives nationally or be put in contact with your local office.
And we really need to warn individuals that these fraudsters are very smart at what they do.
Yes, they are. Yeah.
And so many times what they do is they capitalize on changes that Social Security is doing or updates that Social Security is doing. So that is correct. Social Security is revising the Social Security statement. It's a new statement look. So they're taking the truth, part of that truth, but then diverting it to their fraud area, or they're trying to scam you basically. That happens a lot with cost of living increases when we're alerted that there's a cost of living increase. If there's any changes to dollar amounts, which would be the cost of living increase, Medicare amounts when those change over also, and so they do take partial truths, but then are able to scam individuals that way.
This is a whole topic in itself that we can talk about at another time. Let's refocus on doing business with the Social Security Administration. You talked, Brian, about the account that you can open up online. Can you tell us how to go about doing that? What that process entails?
Absolutely. So it's a very easy process, and we're making it easier all the time to ensure that people can actually get onto it as simply but as securely as possible. So we want to make sure that people are going to socialsecurity.gov/myaccount, and we have a great infographic that we can provide. So go to Social Security, and you want to click on Create an Account or Sign Up to your account. And
so what you're referring to, we can see on the screen.
Yes.
Is that right? Okay. So our viewers can look at the kind of the flow chart about what the process is while you talk about it. Okay.
Yes. So first step would be go to ssa.gov/myaccount, and you'll want to click on Create an Account. And the second step is you'll need to create a credential. So prior to September of 2021, we had what's called an old legacy account for logging in which somebody could create a username and a password. Now you can continue using that method for signing up and signing into your account, but you'll now be prompted to log in using login.gov. It's an external credentialing service provider that we use, that Social Security uses, to simply credential people. Once they create that login.gov account, they'll be brought back to Social Security's website to be authenticated as a user and to get full access to their My Social Security account. If you already have either login.gov or an ID.me account, and ID.me is an external credentialing service provider that we also use, that's often associated with VA veterans.
I think TSA uses that as well.
Yes,
Okay.
IRS uses it also,
uses,
so there's a
yes.
lot of government entities that does use the ID.me.
Correct. So if you already have either one of those credentialing service providers, you can utilize those credentialing service providers on ssa.gov to finish setting up your account. So if you have those three methods, whether it's the old legacy account, login.gov, or ID.me, you can continue using those methods for signing in. But if you're a new user to signing up for an account. You can click on Create an Account, and this will automatically bring you to login.gov to set up your credential. And like I mentioned, it'll bring you back to Social Security's website to be identified. So there's a number of pieces of information that you'll have to provide. It has to match with what we have in our system. And if we've identified you appropriately, you'll have full access to your My Social Security account.
And so you'd really like to have everyone to have that account.
Absolutely.
Is that right?
Absolutely, yes.
I think you mentioned some of the ways the consumer can use the account. Maybe you can elaborate a little bit more on other uses that you have in the account, and why it's a benefit for the consumers to use that.
Right, and you know, it's safe, it's secure, and it actually can interface with your personal account. So when we're talking about retirement benefits, we take the top 35 years of earnings when we do that calculation. So we want, you know, the users, we want those workers who have paid their FICA taxes to go into their account so they can view all of their earnings history. They can count their, you know, personally count up their top 35 years. They can use the calculators online to calculate out their own benefit, so they don't have to pick up the phone or go down to the office and say, you know, what is my benefit going to be at 65 or 67? They can do all of that through the My Social Security account. Once it's secured, once they're logged in, once they're credentialed, then when they use that service, it literally pulls in the information that we have housed under our Social Security database. So the calculations are accurate, and in addition to that, all of those years that an individual works, you want to review that to make sure you're credited with every single year that you've worked, and make sure that that is correct. If for some reason they're looking at their earnings history and they realize it's a missing year, it's an incorrect year, we're able to resolve that very quickly. We just need some type of proof, like a tax return or a W-2, in order for them to get the credit for those years of work. Because remember, the more money you make, right, the more FICA taxes you pay, the higher your benefit is going to be.
Right.
Mm-hmm.
And using this account, it's just so much more convenient than waiting on the phone to talk to somebody.
Absolutely.
Or having to drive somewhere and stand in line to wait to meet with the person, even though those methods of communication and information sharing are still available if people need to use
Absolutely.
those, right?
Absolutely they are, yes. And it's so convenient, like you said. I mean, if we have a disabled person where maybe limited mobility or transportation is an issue, we definitely want them to use that service. It just makes it easier for them to get the information that they need.
Well, I'm sure many of our viewers are delighted to hear that if they didn't already know about the Social Security account that they should sign up for online.
And I also want to mention that it's advancing. I mean, every single month, it seems like there's a new service that's available on the My Social Security account. So you're able to view your earnings, you're able to view the FICA taxes that you've paid, Medicare taxes that you've paid, you're able to see your quarters of coverage, you're able to see or pull down what we call a benefit verification. Let's say that you are going to take out a loan or going to buy a house, and you need verification of what your benefit is. Well, you can pull that right off of the My Social Security account and print it out. As well as those calculators are great. I know our financial planners, they love those calculators because they have their clients complete the calculator before they go into their meeting, the retirement meeting, and they have the true numbers there of what they're actually going to receive. Mm-hmm.
You said a word that prompted me to want to ask this next question. We are in the Medicare enrollment season. It's frustrating for a lot of people to have to work through that. What advice, what information can you share with our viewers about Medicare enrollment, what to do, what not to do, what to watch out for?
Right, and I think that the most important thing is to understand that your Medicare enrollment, initial enrollment, is based on when you need that Medicare coverage. Whether you're leaving your job and you need to enroll in order to have coverage after you leave your job, or it could be that you are receiving benefits and you receive that Medicare card in the mail. What do you do? Do you want both A and B? So that's the initial enrollment when you first get your coverage. Once you're on benefits and you have your Part A, which is the hospital insurance, and then your Part B, which is the supplemental health insurance. Part B is the piece that covers 80% of outpatient doctor and clinic visits. Part B is the piece that costs $174 per month for a premium in 2024. Now, when you're on your A and your B, most individuals do pick a supplemental plan to cover them for the other 20%, right? They pick a plan to cover them for their vision, dental, hearing. They pick a plan to cover them for the prescription drug. But those plans, those supplemental plans and prescription drug plans, are not plans that are sold by Social Security or Medicare. So once you pick that plan through that private health insurance, whether that be Blue Cross Blue Shield, UCare, those are the plans that you should review every year, and then you have this window which we're talking about right now, in order to be able to change those plans. So that Medicare enrollment, annual enrollment, is really for those individuals who are already on Medicare and they choose to review or change their plan.
So if a person needs some information or assistance in selecting a Medicare plan or re-upping their plan, they should always talk to a licensed representative, right? I mean, we see a lot of ads on TV about Medicare programs. How can one be sure that they're talking to an authority that is a legitimate spokesperson for the programs?
Right. Well, I recommend Senior Linkage Line. Senior Linkage Line is an amazing department. They are under the state of Minnesota, and they're partially contracted through Medicare in order to help an individual find that plan that best fits their needs. And it's they're just awesome. They've won like a number of awards and accolades. We work really closely with the Department on Aging and Senior Linkage Line in order for an individual to be able to find the plan that fits their needs. Now, they don't sell the plans, but they are very educated and know these plans inside and out, where if an individual calls them and says, we have, my situation is like this. These are my health needs. These are my prescription drug needs. They actually can type it into a program that pulls out the most, beneficial insurance plans that would fit your need or would fit Brian's need. And so they are licensed, and they are able to give you great information. And they're non-biased, right, because they're not selling a plan, and they'll be able to give you the information for you to be able to select the plan that you need.
And that's free. That's a free service.
That is totally a free service, yes. And the number is 1-800-333-2433. I have it off the top of my head because I say it so often.
Well, Rhonda, say it once more for our viewers.
So this would be a telephone number for the Senior Linkage Line, and that is 1-800-333-2433.
So we have contact information for the Social Security Administration scrolling across our screen. I'll see if I can have that number added as well, because that's a real benefit that people should know about.
Absolutely. And just so for the listeners, the number for Social Security is 1-800-772-1213. So that's 800-772-1213, which is different than the Senior Linkage Line, of course.
Right.
And I would like to point out, too, that for the Medicare Part A and B, the original forms of Medicare, that's where Social Security will get involved in helping folks sign up for that original form of Medicare. So again, that supplement that Rhonda was talking about, or the Medicare Advantage plans, are all through those private insurance companies. And we do like to point people on how to sign up for Part A and B by going directly to our website at socialsecurity.gov/Medicare. And they can look at how to enroll, whether you're going to be initially enrolled at 65, or how to enroll as a special enrollment period after 65 and after your group health plan coverage stopped from current work. And then we like to point people also to Medicare.gov for more specific information about specific Medicare coverage questions, what's being covered exactly, and for, again, those supplemental policies.
Right. You know, we get so many calls at Social Security regarding Medicare and Medicare coverage. So what we need to let our viewers know is that Social Security is an agent for Medicare. What we do is, number one, we determine eligibility. Number two, we can take the application. And number three, we're the ones that pull that $174 out of that Social Security benefit check in order to pay for the Part B premium. But if it's a question of, is this ambulance service going to be covered, or are these services that I'm seeking going to be covered, that's when you definitely have to contact Medicare, not Social Security.
That's an important clarification
Yes.
and distinction. Yeah, thanks. Well, we have a few minutes left in the program today. I know one of the priorities for the agency is the outreach program, the outreach services that you offer. Can you tell us a little bit about what that is and how it works?
Sure. Brian, do you want to take that one?
Yeah, so I mean, we are contacted on a regular basis from our state partnerships. One of my most prevalent presentations that I give throughout the year is for the state of Minnesota employees, about 60 to 70,000 employees covered under state plans. And we provide presentations on a monthly, if not bi-monthly period. Otherwise, like I mentioned, Fortune 500 companies, small businesses, and we're reaching out to county workers as well, just to educate them and further educate their clientele about what we have to offer. So if there's ever an entity that would like to reach out to us to set up a time to present, we are always open for further presentations.
And it's easy to do that. You can go to our website, socialsecurity.gov, and the easiest way actually is just to type in search, ask for a speaker, and then they complete like a short form, and that's sent to us, well actually to our director, and then our director distributes it to, you know, Brian or I that are going to be able to cover that session. Yeah. Everything's free of charge, but we really encourage individuals that if you run your staff meetings, if you're an HR individual in a corporation, an educator, and you would like more information about Social Security, you can always contact us and we can work to see how we can get an educational class or an educational session for your employees.
And again, the area that you'll travel in order to put on these programs?
Well, travel is a different word. We've been doing, because, you know, we're the government and we don't have a very large budget. So we do the majority of our work via Zoom or the virtual
presentation.
If it's outside the metro area. In the metro area, we pretty much, you know, are able to travel throughout the metro area. Right. But if our Wisconsin offices or our Wisconsin folks would like a presentation, definitely we can do that, but it most likely will be virtually.
Which is something we learned to do during the pandemic.
Absolutely.
Yeah.
Huge shift.
It has opened so many doors for us. It really has. For us, those of us in public affairs, I mean, we used to go to these corporations and do presentations for the people on site. Now we're able to do it throughout the U.S.
Right.
Well, thank you so much for being a guest on Access to Democracy and for all the information that you shared with us, Rhonda and Brian. We really appreciate it, and I'm confident that our viewers have benefited from the program that we've had with you today on Access to Democracy. Thank you for joining us, and see more of accesstodemocracy.com, where our programs are archived.